one of my bosses used to mention earlier. This is all like Bangalore traffic. You try to stop one specific aspect of the cytokine storm. There are like multiple pathways which develop around it, and you will definitely not be able to be 100% successful in any of these cytokine storms. Even though new agents keep coming into the market, even though a lot of research is going into this, I don't think we will be ever 100% successful in sort of targeting all this. But anyway, on a serious note, if you take sort of a very mild disease of coronavirus, I don't think there is much to be done, to be honest. There is a lot of panic going on, which is understandable because a lot of near and dear ones are like getting infected, they are dying, they are seeing people who they know like getting admitted to hospitals. So there is this natural panic which is sort of created amongst the public, and they keep on using all sorts of various available drugs, whether it is necessary, not necessary, which can actually be harmful rather than doing any good to them. And people fail to understand that at various levels. But yeah, like I said, if it comes to mild or asymptomatic disease with just fever, cough, cold, you just treat it like any other flu. You take paracetamol for fever, you hydrate yourself well, you stay at home, you stay isolated, don't try to pass on the infection to others, like keep that always in your mind. And always it is, of course, there is a state of panic, but you also need to like keep checking yourself, you keep monitoring your oxygen levels, you keep monitoring your heart rate, you keep monitoring your respiratory rate, be in touch with a physician, take their advice, and don't unnecessarily treat yourself with remedies that are easily available in the market, especially when it comes to countries like India. So mild disease, just stay active, just stay hydrated, take paracetamol, and keep an eye on the warning signs. Is all I would do. There is nothing else that needs to be done. And 85% of the population 85% of the people who catch coronavirus will be in this state, and they just get better from there. People need to understand this, that not all of them become like severe, and the remaining say 15% who become moderately ill. These are the patients who have low oxygen levels and who have warning signs of COVID and who get admitted to the hospital for like closer monitoring and further treatment which is needed. And for these people, at least according to the current guidelines and evidence which is available, I would say, I think probably we can classify it into steroids, antivirals, and immune modulators as treatment options which are available, and organ support, of course, that is the end game. So when it comes to steroids, dexamethasone is a very important drug which has come into sort of public attention of late. And this has been a fairly common steroid, fairly cheaply available, and it has been there in the market for ages together. And people have been using this left, right, and center for so many other problems and other diseases. But we need to understand that dexamethasone has a role only in patients who are needing oxygen. Even if you become, say, moderately ill, but if you're not needing oxygen, there is no clear role for dexamethasone. So if there is an oxygen requirement, yes, it has shown to be like, major trials have come out, recovery trial has come out, which says that there is a clear benefit with dexamethasone, wherein even though it doesn't necessarily translate into a mortality benefit, say, saying people mortality benefit essentially means that it doesn't prevent you from dying from the disease, but it definitely prevents you from going into a severe form of the disease. The amount of oxygen that is needed comes down. The risk of you going on to need a ventilator comes down. So I would definitely use dexamethasone in those group of patients who have started needing oxygen with moderate disease. And when it comes to antiviral, there is no particular antiviral which has been proven to be successful against COVID so far. Even though there have been a lot of drugs which have been tried, the most common, I think, now everybody knows because of so much media hype, it is remdesivir. So it is basically a nucleotide analog which has been used for other diseases in the past. And if you look at the current evidence which is there for remdesivir, again, it does not have any mortality benefit. People should understand this, that everybody doesn't have to take remdesivir. It is shown to be beneficial only in a very small subset of patients who become moderately ill or need hospitalization, and only in them it decreases the time to recovery, and it sort of prevents you from becoming very sick. But once you're already sick, say for example, if you already need ventilatory support, or say if you're already needing significant amount of oxygen, and if you've progressed into a severe like in COVID disease, there is no clear role or no clear benefit for remdesivir. And people should also remember this: with every single drug there are side effects associated, and they should keep that in mind before just popping pills like anything. um, so that is the thing with remdesivir. And everybody, at least from India currently, they're talking as if this is like an antidote for, like, COVID, which is not true at all. This is partly like, I don't know what to call it, whether it's media hype, whether it is marketing strategies, or it is whether it is just people's reaction to panic. But I think it should be clear that remdesivir is not an antidote, and it has to be prescribed by a physician who is experienced in treating COVID, and it is useful only in a very small subset of patients, and that too just to prevent them from becoming very sick and not prevent them from dying. Okay. And there are, like, a lot of other drugs like Favipiravir, and there is Lopinever and Ritonever, which is very commonly used again in India. And there is something called Ivermectin, which he was mentioning earlier. None of these have shown to have any benefit whatsoever against COVID, and people should stop using that. And I have seen, like, shocking, this was very shocking to me. I've seen, like, prescriptions being sent out on WhatsApp, and people are just circulating it amongst themselves, that these standard, like, 5 to 6 drugs which everybody takes for COVID. Whether they're like, whether they need it, whether they don't need it, they just take these 5 6 drugs, which is very unfortunate. And yeah, like I said, these are not shown to be these are not shown to have any benefits whatsoever against COVID, at least according to the evidence that we have so far. And when it comes to the last class of drugs, I would call them immune modulators. The one which is probably well known now is Toziluzumab. Toziluzumab is a good drug because it has been shown to be effective in other diseases, like especially rheumatoid arthritis. This has been time tested drug. And I think according to the latest evidence, we have had this remap cap and recovery trials again, wherein tocilizumab has definitely shown to be beneficial. But again, like I said, it is very selective. It has to be used in people who are, like, moderate to severe, who have got moderate to severe COVID disease, and who are starting to need higher oxygen supports. People who are not needing oxygen support, they don't need this. People who are on very less amount of oxygen as well, I think there is still a lot of ongoing discussion whether to use them in that or not. But in people who are needing very high amount of oxygen, or people who end up being ventilated on the intensive care unit, who need a ventilator. So yeah, I was talking about tocilizumab earlier, and the immunomodulators. I think yeah, so it has definitely shown some promise, and its use should be selective, like I said earlier, and it should be restricted to patients who are needing very high amounts of oxygen with high level of inflammatory markers, especially something called C-reactive protein. We take a cutoff of 75 on that, and if people have got more than 75 of C-reactive protein, and if they are like very ill, moderate to severe disease, and if they've been needing oxygen in the last 24-48 hours, that is the right time to use tocilizumab, and that has shown to have some benefits. So yeah, so you can use a single dose, or probably based on the clinical response to the first dose, probably you can use a second dose as well. And I don't know how easily it is available nowadays in India, but I'm sure like there is scarcity for that as well. And probably it will prove to be a bit more expensive for Indian market compared to, like, here where we get it free of cost. But yeah, I think that should be something which we should concentrate on: tocilizumab, remdesivir selectively, and definitely dexamethasone for most of the patients who need oxygen. So these are the only three sort of drugs which we have used, at least with good evidence base so far, at least in the second wave of the pandemic, even though various other things have been tried. But there is no real evidence to use any of those. And the last, probably the important aspect of treatment for this coronavirus disease is anticoagulation or blood thinners, like you mentioned earlier. And yes, there are, like, this disease is known to cause very small clots in all the blood vessels anywhere in the body, to be honest. And most of it happens in the lung initially, and that is why they go into the state of hypoxia or a low oxygen state. And it is very difficult after, like, a certain point to help them recover from this state of hypoxia. Even with the best of the ventilators and with 100% oxygen, we struggle sometimes. But this is all in a very small subset of patients, which we see on intensive care unit, and people don't have to panic about this again. Yeah, so when it comes to blood thinners, there have been like a lot of studies and a lot of evidence which has come out in the last, say, 1.5 years after this disease started, and most of it points to the fact that at least all the patients who are admitted to the hospital need to be on some form of blood thinners as a prophylaxis to prevent blood clot formation, and that is a small dose which we use in intensive care all the time on all the patients admitted to intensive care, whether it is coronavirus or anything else, because patients have reduced mobility and they are known to form clots. But in coronavirus disease, the pathology itself is like that, it is known to form clots, and so it is logical, and it is just like, common sense to use this drug to prevent clot formation. But when it comes to the next stage, which we call anticoagulation, anticoagulation basically means you give a higher dose of blood thinners so that your blood is constantly in a state of, in a liquid state, wherein it is very difficult to form clots. And this is at least according to the evidence which is available currently. There is no clear indication to give anticoagulation dose of blood thinners for everyone. But of course, if you are suspecting that this person has a very high risk of clot formation, like if there are clots in the, say, leg veins, which are the most common source of blood clot formation anywhere in the body, or if there is a clot sitting in the lung, which is called a pulmonary embolism, or if you are known to see clots in any of the upper arm veins or the lower limb veins, then definitely yes, like, they need to get anticoagulation dose of blood thinners. And when it comes to common drugs like aspirin, Ecosprin, which he was mentioning earlier, or Clopidogrel, which are mostly used in cardiac patients, like people who have had heart attacks in the past, or people who need, like, who have higher risk factors for prevention of further heart attacks. Cardiologists generally prescribe these drugs, and these are not necessarily blood thinners, but they are called antiplatelet drugs, which work against, like, platelet function and helps to keep the blood thinner. These are not necessarily indicated in all. People have been using it left, right, and center, like, Ecosprin and Clopidogrel, but the evidence is not significantly there still to use. And aspirin was one of the parts of the recovery trial, one of the arms of the recovery trial, if I can call it that. And I don't think they have come to a conclusion wherein it has shown clear mortality or mortality benefit, or to prevent people from going into severe disease. So I would use it very selectively again. In patients who are already on antiplatelets, definitely it is worthwhile continuing on them. But whether to start them, like, fresh on antiplatelets, again, it is highly selective, and you have to tailor it individually to patients based on their needs. So these are the things. And of course, like, if they end up severely ill, of course the only thing that can save people is oxygen. And there are different modalities in which we can give oxygen, like starting from low flow nasal oxygen, wherein you see people using just these nasal prongs with very little oxygen, 1 to 2 liters of oxygen. And it is, I don't know how, if people are using it properly, and this has probably led to a lot of oxygen shortage in India. People don't need oxygen if their saturations are more than 90 or 92%. They can tolerate that level of oxygen in the body, and organs can function very well with that level of oxygen. I think people need to understand that as well. Unnecessarily using oxygen on people who don't need oxygen definitely creates more scarcity, more panic, and more problems to the whole community. And this is a pandemic, so we have to take care of each other and, like, rationalize the use of oxygen, I would say. And if they're not getting better, then you go on to high flow nasal cannula, wherein you use higher levels of oxygen. And if that does not work, then you use what is called as a CPAP or a BiPAP, which is again a tight fitting mask applied to the face, and you give oxygen under pressure. And if that is not working, then the last resort is to put a tube down the throat, which is called invasive mechanical ventilation, and continue to ventilate them on a ventilator. So this is the various sort of steps in which we escalate patients who need, like, who keep on needing higher and higher amount of oxygen as the disease progresses. So I think this is in sort of total the sort of treatment that we would generally give a coronavirus patient. And yeah.
Okay.
And
And you,
definitely, sorry, last point. I think definitely it is important to keep it in mind that this is a virus and antibiotics don't work. People need to understand that, like, they're using all sorts of antibiotics just empirically, and this will just cause more antimicrobial resistance rather than, like, causing any help.